A bit of hope today. The University of Kansas Health System reports a decrease in hospitalizations due to COVID-19. While doctors say it's possible we've hit a plateau, one model suggests we have not yet hit our peak. 41 Action News investigator Jessica McMaster shows us why some people are optimistic.
This predictive model shows we are still 13 days away from peak in both Kansas and Missouri. While it's still too soon to say for sure, doctors in Kansas say COVID-19 cases may be on the downward trend.
I'm hoping if our hospital is any indicator that we will maybe see a slowing of the infections.
When it comes to COVID-19, Dr. Dana Hawkinson says the patient load is a little lighter at University of Kansas Health System. Right now, the hospital is treating 33 patients for the virus. The amount of patients on ventilators also down, a positive sign for Dr. Stites.
We have 9 ventilators today. We had 13 on Friday. Even if we're on some part of the limb, that feels good to me.
For weeks, Dr. Stites and Dr. Hawkinson have stressed the importance of bending the curve by sheltering at home.
I am cautiously optimistic about the curve in Kansas. And again, we'll know more later.
While it's too soon to know if we've successfully bent the curve, other states are seeing major increases in cases.
It's going to touch all of us, right? It's going to touch all of us.
According to this projection model, New York is expected to peak this week and have a shortage of more than 12,000 hospital beds. While Kansas and Missouri's estimated peak date is 2 weeks out, the model predicts no shortage of beds here. But that could change.
Because all it takes is one gathering of 5, 6, 10 people, or a celebration, or some sort of thing like that, where then you have 2, 3, 4 people who are infected, and that can spread exponentially.
While Dr. Stites says he's cautiously optimistic, there's still work to be done if we want to beat COVID-19.
And so we have to choose to beat Corona, and we're going to do that. We are going to do that. And we're going to beat it by the actions of every person every day who decides to shelter, wash, not touch their face, keep their distance, wear a mask in public, and do those things we believe will help us get to the other side.
More data is expected to come in over the next couple of days. That will give us a better indicator as to if we are bending the curve. If COVID-19 cases are slowing down and people continue to shelter at home, the doctors you heard from there just now say we could all come out of this sooner than anticipated. I'm investigator Jessica McMaster, 41 Action News.
Along with KU Hospital, we also checked in with St. Luke's Health System. They have 25 patients hospitalized with COVID-19. That's the same number as Friday.